Okay, so we're going to start looking at post-traumatic stress disorder, but I also want to consider and talk about the ongoing impacts of trauma because, in truth, while tens of millions of us experience traumatic events, very often we don't meet full criteria for a diagnosis of PTSD. The threshold for that diagnosis is pretty high, and what's extraordinary to me is that PTSD is the only diagnosis that unequivocally points towards the experience of surviving trauma. None of our other mental health conditions necessarily indicate that a person has survived traumatic events. So a lot of us end up being diagnosed with things like generalized anxiety disorder or depression, when the true cause of our mental illness or our struggle in life is having survived traumatic events. As a therapist, I have erred towards overdiagnosing perhaps PTSD because I'm uncomfortable saying that a person's struggles are attributable to something other than trauma. So, PTSD includes symptoms like hypervigilance, intrusive thoughts, nightmares, night terrors, flashbacks. And these are extraordinarily painful experiences. Hypervigilance is having a uh, exceptionally high degree of awareness of one's environment and being overly aware of sensory input. So all five of our senses are on high alert, and we tend to notice changes, or we're always monitoring for threats in our environment. Intrusive thoughts are sometimes recollections of memory in a stunted form, or just ideas or imagery that's entering our mind that we truly don't want there. Nightmares and night terrors are oftentimes reliving past events or themes that are recurring and tied to those past events. A person who's experiencing night terrors is kind of caught between being awake and being asleep, being in the middle of those fears and reliving those experiences. When those happen during waking hours, we call them flashbacks. It is not simply recalling past events, it is re experiencing them, feeling as though they're happening all over again. So, folks who live with PTSD have a long road to recovery, and unfortunately, a lot of us tend to be dually diagnosed, which is to say, it's very common for survivors of trauma to have a secondary diagnosis. A lot of us use substances to cope and found ourselves with a substance use disorder. Others of us self harmed or developed an eating disorder or other unhealthy habits in an attempt to cope with something that was chronically overwhelming. For most of my career, for almost 2 decades now, I focused almost exclusively on three things: trauma and addiction recovery, and helping healers to overcome both of those things, because I crave ripple effects and I want to help folks who are willing to transform their lives. Those are my heroes and the people I'm most invested in helping. So, overcoming trauma requires having a sense of safety in the here and now, and safety is the most vital and important of human needs, and yet it's something I rarely hear talked about professionally. My experience is that authenticity is the key to helping others feel safe. I've been working with survivors for a long time now, and at some point early on, I had to accept that however I presented myself, whatever I chose to share or not share, the people that I serve have the ability to intuitively, instinctually know a great deal about me. And I think the difference between me and other healers they've experienced is that I'm very comfortable with me. I like the person that they're intuitively getting a sense of. And because I'm not working from a persona, because I'm very genuine in my interactions, that makes for less work. That's less that they have to interpret or decode about me. Um, we frequently have conversations about trust when I work with folks who have PTSD. They will explain or ask that I be patient with them as they'll be slow to develop trust. And my response to that is always, I don't really need you to trust me. I need you to trust yourself. Because if you trust you, you'll be able to listen for what resonates, things that not only make sense but feel true. You'll be able to put stock in your own intuition, and ideally, it will help you to overcome things like self doubt. So, that focus is on the individual and not on the practitioner. And so, intrinsically, it's healthier, it's more manageable, and it's a key to transformation. We tend to have a great awareness of how we interact with others and not with ourselves. So, my hope for the survivor, but really for anyone who's overcoming any form of mental illness, is to have a greater awareness of self and to have more harmony with self. And we'll talk about that a little more in the next video.